and
Mm-hmm.
I have also lost my mother because of cancer ovary. So this is something which is troubling me a lot, although it is
Mm-hmm.
difficult, but I'm trying to overcome this.
Please accept my condolences for your mother and how your sister is doing now.
My sister is undergoing the treatment.
Mm-hmm. Okay. And please accept my apology. My consultant is not here. Is it okay if I continue the consultation? And sure, I will arrange the next appointment with my consultant as soon as possible.
Oh yeah, that's great, doctor. Thank you.
Mm-hmm. Anna, I understand from your notes that you are here to discuss your reports. Is that right?
Yes.
Any other concerns and expectation?
No, doctor, I just wanted to know what are my reports
Mm-hmm.
and
Okay.
how to go
Uh,
ahead further.
okay, sure. Sure, I will discuss the results in a moment. Together, we formulate the management plan. Is it okay if I gather few details from you? Then we discuss the management plan.
Yeah,
Mhm. Anna, currently, do you have any problems?
I don't have any problems as of now, doctor.
Mhm. Do you feel full quickly or any bloating?
No,
Any change in weight and appetite?
not noted recently. Nothing like that.
Mhm. Any lump in the breast, have you noticed?
No, I'm not
Mhm.
examined myself.
Okay, that's fine. Any change in waterworks and bowel, have you noticed?
No,
Can you tell me about your periods?
my periods are pretty regular. The last period was 2 week back.
Mhm. Any pain or bleeding between the periods?
No,
Mhm. Have you ever used a combined oral contraceptive pills?
yeah, initially I used it. Now I am not.
How long?
I used quite a lot time, 3 to 4 years.
Okay. And your cervical screening is up to date and normal.
Yeah.
Ever you been pregnant before?
Yes, doctor. I'm having a son who is 4 year old now.
Okay. How your son was delivered?
It is a normal labor.
Okay. And do you have any plans in the future?
Yeah, I'm keen to have one more baby.
Sure. And have you breastfeed your son?
Yeah.
That's good. And any health issues for which you're following your GP?
No.
Okay. Are you on any medications?
No.
Any allergies?
No.
Mhm. Sorry to bring back the memories. Can you tell me the details about your mother and the sister at which age they were diagnosed and what treatment they have given?
My mother sister is just 42-year-old, and my mother died at the age of 50 after
Mhm.
struggling to cope with this cancer ovary for 8, 10 years.
I'm sorry to hear about that. So, do you have enough support at home, Anna?
Yeah.
Okay. And whom do you live with?
I stay with my husband, doctor.
Okay. And do you smoke?
No.
Okay. And are you aware of your weight to height ratio?
Yeah, it's normal.
Okay. And do you feel down, depressed, hopeless because of this situation at any time?
No.
Mhm. Thank you so much for giving me all these information, Anna. Anything else important you want to add?
No, doctor. That's it.
Mhm. Anna, is it okay if I examine you the presence of chaperone just to check your general health by checking your blood pressure and the pulse, and also look at your breast as well to see if there is any lump? That be all
Uh,
right?
yeah, it's okay.
Mhm. Okay.
Okay.
I can see that you are alone, Anna. Do you want to call someone? I have to give you a lot of information.
No, doctor. It's okay.
Anna, actually, I don't have the good news for you. Actually, I understand from your GP letter, this reports belongs to you, and I'm sorry to tell you that your reports came back as positive for the BRCA1.
Oh my God. So what does this mean to me?
Do you have any idea that what the BRCA means?
No, actually I do not have. They just say something related to cancer gene, cancer gene. I don't know exactly what it is.
Mhm. Let me tell you that these are the breast cancer protective genes that helps to repair the damage during the cell division. But whenever there is a fault happen, so the repair does not happen. So they keep on dividing and increase the risk of the having the cancer. So I'm sorry to inform you about that. Having the BRCA1 gene positive means that your cancer risk for the ovary will be around 35 to 45 in 100, and also risk of the breast cancer will be increased by 7 in 10. But don't worry, having the positive gene does not mean that you are 100% you will going to develop the cancer. We have the measures by which we can reduce the risk.
How, doctor? How you are going to reduce the risk?
Yes. So we are going to involve the team of the doctors, including my consultant and the fertility specialist, also the cancer specialist, specialist nurse, and also we will put you in touch with the counselors and support group as well. So they will help you to cope with the situation. Would that be all right for you, Anna?
Okay. Yeah.
Okay. So Anna, we have the measures like the some lifestyle modification and some uh, chemo prevention and the surgery. Okay, so I can see that you did not complete your family, so we advise you to complete your family as soon as possible. And otherwise, we can freeze your eggs, or later on you can go ahead with the. Do you want to discuss more about that,
Yeah, I wanted to
Nara?
know all the options also, doctor. What I wanted to know about
Uh,
treatment, wanted to know about options of me becoming pregnant.
Yes, so we will arrange a referral to the fertility specialist. They will freeze your eggs as well, or the later on you can we will put your eggs and sperm of your partner, make the baby and put into the womb of another lady called the surrogacy or the adoption. So these are the certain options available for your having the baby. Am I clear till that point?
Okay.
Regarding the how we can prevent this risk, having the maintaining the healthy lifestyle and doing the exercises on the regular basis, and also the combined or contraceptive pills can reduce the risk of the cancer as well. And regarding the testing, we don't have the any test available which can predict the risk of the ovarian cancer, like the scans and the proteins. They are not reliable. Am I clear so far? Any questions?
I didn't get you, doctor.
I mean to say that the regarding the testing, tests are not they are not much predictive to predict the cancer by the early stage. Like the ultrasounds and the some proteins which can predict the
Okay.
cancer risk, they are not. Am I clear?
Okay.
Okay, so regarding the once you complete your family, we will offer you the surgery, in which our purpose is to remove the tubes and the ovary, which can be done by the keyhole procedure to reduce the risk of the ovarian cancer by means of the 95 by 100. We can reduce the risk of the ovary, and also the breast cancer can be reduced by the in half of the cases. Uh, but we cannot 100% eliminate the risk. Still, there is a chance of developing the cancer 2 in 100 from the surrounding layer lining of the tummy. Are you with me so far?
Okay.
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 Uh, as it is a surgery, so it carries the risk of the anesthesia and also the surgery risk like the infection, bleeding, damage to the nearby organs. But we take all the precautions to reduce this risk. After we remove the ovaries, as it releases the important hormones that can protect our heart-born brain, so we discuss with you the hormone replacement treatment. We will arrange a referral to the menopausal clinic till the age of the 51. Any questions so far?
No, doctor. Actually, I wanted to know regarding this options of me getting pregnant and whether there are any chances of this gene passing to my baby.
Um, Regarding your yes, this is a good valid question you have asked from me. Yes, as it runs in the family, it can pass to the your daughters. But if, before you get the pregnant, we will offer you some testing, that is the pre-implantation genetic diagnosis, in which we will test your eggs and the before implanting into the womb of you by means of the test tube baby.
Okay.
Okay. Regarding your breast cancer, are you getting me any question? Any questions you are having?
No, doctor, that's it. Thank you.
Regarding your breast cancer, we advise to do the self examination, and also we will arrange the scans and the mammograms if need arises. But these are the it can predict the risk, but it cannot. It helps us to early detect any changes in the breast. And some women may choose the breast reducing surgery, which can reduce the risk by 90%, but it has some psychological implications. So you can discuss with a specialist or if you wish.
Okay, doctor. Thank you.
I will give you some written information. I will document my consultation and write back to your GP about our agreed plan, and connect you to the counselors and support group. Thank you so much.
Thank you, dear. Okay, your own reflection. You took 2 minute almost extra. Okay, 1 minute 45 second extra.
Okay, ma'am. Actually, I was. It was. I want to say the scans are not reliable. I think I was not clear in my explanation.
Hmm. No, I will tell you that why you examine the patient.
Just ma'am, I think it's not necessary. I just see the any breast lump. I think it's not necessary
No,
here.
no, it's not necessary. You can ask her and you can refer her for this screening, NHS breast screening program.
Okay, okay.
Okay.
Yes, ma'am. Okay.
She is eligible for that.
Yes, ma'am. Yeah.
Yeah. So rather than that, that would have been a good point. Okay, I will be referring you to NHS breast screening program. Do continue doing that. Okay.
Okay. Okay, ma'am.
Okay. Now tell me, what is your good points? Anything, anywhere you wanted to reflect and say that I wanted to change this thing or that thing? You have done a good job. Anybody wanted to say anything after Rekha says? We will discuss your thoughts also, and then let's see the answer key.
Mm-hmm. Um. Just maybe my patient is not satisfied with me. I thought.
No, no, I was satisfied. I was satisfied. I was satisfied. I was not, because I wanted to see. I wanted to know the
Mm-hmm.
options also. What are my options? And then I wanted to
Mm-hmm.
know about my delay labor because baby. Okay, because I wanted to
Mm-hmm.
have more babies. Okay,
Yes, ma'am. Yeah.
two concerns are here. My first, my concern is I wanted to know my report. If it is positive, then I wanted to know my management. Third concern, I wanted to know my options of getting pregnant and avoiding these conditions to passing on to my baby. Okay. 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 Let's go. If it is a egg freezing, I wanted to ask you: is it whether I am eligible for NHS funding of egg freezing?
Ma'am, she can be because her she is test positive for the BRCA, so I think she will be eligible.
Okay. Do you have
No,
any
ma'am?
short thing? I am searching, but I'm not getting anything regarding that. In cancer, yes, in cancer they are eligible,
That's
but
the
she's
thing.
yeah,
Yes, ma'am, in the
yeah.
cancer.
In the cancer, diagnosed cancer, but here she's not diagnosed cancer.
But ma'am, she is test positive for the BRCA, so her it can transmit to her baby. So that's why I'm not sure, but I think.
No, we need to find it out. That could be a
Okay,
question.
ma'am, I will search for that. Yes.
Okay, that could be, and put it into the group. Okay, do not
Okay.
only have your answer. But I feel because it has not been mentioned anywhere, so that is one question whether I will be eligible for funding if I decided to go for that. Uh, okay, uh, your own reflection.
That's all, ma'am.
Nothing. Okay. Anybody wanted to add any point? Please, girls, come up. Talk to Miss. Have a more interactive session. Anybody, because me and the presenter only are talking. It should be
Ma'am,
very good communication, two way. Yeah.
I just want to know This patient name is different in two places. It's like Anna, and the other one is Sarah.
Yes, ma'am. I Sarah is her. I
Oh,
was. She was. Sarah.
sorry,
I
sorry,
think her
sorry.
sister is.
Yeah.
She is
They-
Sarah, but I
No, no, the
using the name
No, no,
differently.
no, 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 because I just wanted to. This is also shared recall by someone. So I thought of not having the same name.
ma'am, one more thing.
Okay.
This is just a, so. Is it that we have to discuss like a breaking bad news of a diagnosed cancer?
I no, no, no.
Because
That is also I'm coming to that also. No, I don't think so. It is not a big BBN. It's partial BBN. That okay, we are having some concern, and your reports for BRCA1 is positive. But that
unlike
doesn't.
as it,
Yeah, it is not a complete BBN. It is not a complete BBN. It is a partial BBN.
and opening questions like we can ask about herself, her patient to discuss about her condition, than telling, "I'm so sorry" at the starting point. It's not correct. I feel so. Um, that's what I
Regarding what
felt.
here? Regarding what?
Like starting opening questions was like, "I'm so sorry." So that is not the starting point. I feel like we can tell the patient to explain her own condition in her own words.
Yeah, that is okay. Different persons are having a different approach. So I am not, I don't want to change their approach very drastically. Okay. Anyway, means different doctors will be seeing a patients on a different mode. This has been accepted by RCOG also. They also do not want that you should be no, you should not grade them. You should, everybody is having a freedom. Okay. So you may not be liking, but the other person may be liking, and even RCOG is not having any objection for that. Okay, you can go according to your way, and she can go according to her way. So she, if she thinks, but why she has thought of doing this way, it must be because of that lay. This kind of task most of the times are associated with lay examiner. So whenever the lays are there na, they just want to have a very good rapport, very good rapport. They wanted to acknowledge the pain they are going through. They wanted to acknowledge their losses. Okay, and that is a star mark in lay examiner's answer sheet. So
Okay.
yeah, so it is not for our own, means if it is a clear case, cut case, who has come and without any lay, you can straight away go that I am having a GP letter, and which says that this is this. So something like that you can very easily say. So that is not having any association. Anything else?
Ma'am,
Hmm?
just before the surgery, also we need to do CA 125 and TVS to detect any undetected occult
And
cancer.
we will come to that also, how we are going to do that. TVS and
We have
CA125
to
prior to surgery.
include.
No, we will see. We will see. Okay. Anything else?
And for breast cancer screening, yearly MRI, mammography.
That needs to be, she needs to be directed to the surgeon for that.
Okay.
Okay. We are here to guide her regarding the ovarian risk, cancer risk. Okay. That breast cancer risk can be guided to a MDT. So she will be followed up in this NHS breast screening pathway or program, and a surgeon will discuss the options regarding the breast cancer. Okay, whether she will require a yearly mammogram. You can also say that you will be requiring, but involve your surgery colleague. Anyway, breast cancer you are not going to manage. Hmm? So that one
Yes, ma'am.
point, yeah, one point. Very nice observation. Anybody else wanted to? Rajni, you wanted to say something? Rajni, any other person? No? Okay. Now coming to the answer key, what I had mentioned. Uh, empathy for her mom, introduction, straight away introduction, mom's date and sister's diagnosis. Let her go ahead, talk to her. If she, you are thinking that patient is having psychological impact, you can offer her counselor here also. Aim of the consultation is discussion of the reports of her cancer gene. uh, you can ask here, you can ask while discussing whether she has. Anyway, Rekha, you have done a very good job. I do have only few points to add to these options. Okay, very boldly you had mentioned regarding examination, which I said no, no need of examination here. uh,
Yes, ma'am.
Okay, yeah. History taking was 5 minutes. You could have minimize it to 4 minutes, and that from there you could have saved your 1 minute extra to address my more concerns. Okay, so
Ma'am,
that
which
is
points I can omit in my history which seems unnecessary?
uh yeah, we will see that also. This mother and sister details. See, mother and sister details basically I would have said is important when she has. We need to assess whether it is because of BRCA or whether it is not. So it is sporadic cancer. But in this case,
Okay.
you are having a report.
Mm-hmm.
Okay, so you are having a report. I think I will not
Ma'am,
ask.
where we want to offer the screening here, we can take the details of that, but already she is test for positive, so no need, ma'am.
No need. See, she's
Okay, okay.
positive. If she has a history, if she's having a not had undergone the test, and you are going to decide whether I need to test her, then at that time this history is
Mm-hmm.
important. Here,
Yes,
this
I got it.
history, yeah, this history, I will not say examination not needed. Rest of the history was perfect. I don't have anything to say about that because it was quite good. Okay, open, mostly open question. Still, 30 seconds you could have means extracted by not asking mother sister history and this
Yes, ma'am.
examination. Okay,
Okay.
and then
Okay, ma'am.
BBN
Thank
pattern.
you.
It is not BBN pattern, it is partial BBN pattern. Again, that took your extra 30 seconds.
Ma'am, partial
See,
BBN, we will not call anyone and we just say we have some concerning news.
yeah, we have some concerning room news. Are you aware about your reports? No, I do have some
Mm.
concerns with your reports. The your reports, which we had sent it for cancer gene detection, has come positive for BRCA1 gene. Okay, pause it, let it digest, and then explain her. Okay, so
Mm.
do you know what is this BRCA gene? And then explain her this way. And then
Yeah,
BRCA gene
okay.
explanation also, I think could have been too
Shortened.
much detail. Yeah, too much details of that BRCA gene could have been. I will say that these are the genes which are, if they are positive, they are associated with the cancer of breast, ovaries, as compared to the
Mm.
general population. Why you
And
wanted
no
to say
need to
that
mention the percentages, ma'am.
percentages? Yeah, you need to mention the percentages, but this
Mm-hmm.
explanation that these are repair and repair means I will get
No
confused.
need. Okay.
Yeah, I
Yes,
will
ma'am.
get
Okay. Okay.
confused. I will, even the PIL is not saying means in this much details. So these are the genes which are associated. The positive, if these genes are present, these are associated with cancer, of increased risk of cancer in ovaries and breast as compared to a general population.
Okay. Okay, ma'am. I get your point. Yes.
Okay, as compared to general population. Um,
Ma'am, even for the lynch, we will not say, and ma'am, for the lynch explanation, what we will explanation we will give.
Even Lynch
Sorry,
also, I
this
will
is
say,
not involved.
yeah. So yeah, no. So these are the genes which are which is associated with uh, overproduction, overexcite means overproduction, and cancerous tendency to form a cancerous cell. You can max to max say that.
Okay.
When these genes are present in our body,
Mm-hmm. Mm.
these genes
Increase
makes
the
more,
tendency to.
yeah, and it increase the tendency to form more cancerous genes. Okay,
Okay. Okay, ma'am.
cancerous
Okay.
cells. Okay, cancer. See, we just need to mention make it more and more simplified. This will not have any implicate things. Okay, what is the role of BRCA? They will not assess. They just wanted to know what is the implication of this. So this has come positive.
Okay.
So that could have also been minimized. So apart
Also
from
save the
this,
time. Yes,
yeah,
ma'am.
yeah, you could have saved the time. Uh, Then aim of the consultation, testing for cancer gene, correct. Explore her concerns. I wanted to know here. My concern is I wanted to know about the report. In a subsequent ways, I do have my concern. Okay, so very nicely you had started asking me the history of occult CA or red flag signs. Any bloating, any distension in tummy, any bloating, tummy upset, loss of weight, loss of appetite, menstrual history. It is regular. Even I don't want to keep on asking, so I elaborately said IMP, LMP, IMB, PCOS history also. You PCOS or basically any endometrial bleeding you wanted to know, you should rule out. Smear and contraception which you had used, COC specifically you used, obstetric history, current fertility and future fertility which you had asked, contraception basically here again I had mentioned COC pills, medical, surgical, VTE, because we may be considering starting her on HRT or COC. That could be the reason. But VTE particularly, if not asked, it is still okay. Okay. Any other member in the family who are having cancers in the ovaries, colon, or breast? That is my question here, not any other. Okay. Risk factors: smoking, alcohol, BMI, smear. Smear basically we had already asked, but this question should not be missed out. Are you following a self breast exam? Are you doing a self breast examination? Have you okay? Yes, doctor,
Yes,
or
ma'am.
no, doctor? So if yes, appreciate. If not done, please say I will suggest you to examine your to follow self breast examination. I will share the leaflet regarding that. Okay, you can share the leaflet how to do it, or I will teach you. Max to max I will teach you.
Okay.
And do you feel
Okay.
supported? Okay, do you feel supported? Now management, checking background knowledge about the report. This is partial BBN, partial BBN. I do have some concerns with your report. The report of the test for cancer gene has come positive for BRCA1 gene. This means what? This means she is more susceptible to develop breast and ovarian cancer as compared to general population. So general population incidences is 1 in 70. Hmm? Then my numbers come.
Yes, ma'am.
Yeah, so woman with BRCA1 mutation have a life. These numbers carries mark. Okay, this number carries mark. So woman of BRCA1 will have increased risk of cancer by the age of 70. If it is BRCA1, you can just explain here BRCA1. No need to explain her BRCA2 because we had a specific BRCA1
Yes, ma'am.
report. But
Only BRCA one we have on.
yeah,
Yes. Yeah.
here I had shared it just for the sake of knowledge. 63% up to 63% if it is breast cancer, and 85% of ovarian cancer, and 84%
Ma'am,
ovarian cancer.
ma'am, sorry to interrupt you, ma'am. In the we will follow the talk. In the talk, it was mentioned 35 to 45%
See this,
risk of
no,
ovarian.
I will say here that NHS website, this
Okay.
screenshot I have applied from that there
Okay,
only.
ma'am. So we will follow the NHS website. Okay.
Yeah, because that is for the general population.
Mm-hmm.
Okay, so they are having that access to NHS website, which is actually a patient information website
Leaflet.
link.
Okay.
Website link. Okay, so that's the reason I had followed this. So this is our numbers here. Okay, now again this number is very important. AD, that is type of inheritance. 1 out of 2. This means if this gene is present, there is a chance of 1 out of 2 babies born to the person will be carrying this gene. Hmm? This also you need to explain that this is a genetic condition transferred from means one generation to the other generation. That means if your parents are having that, so 2 out of 1 sibling
Mm-hmm.
will be having this condition. Okay, so that one
Mm-hmm.
needs to be explained. And her
Okay.
child is also at risk of having this condition. So what can be done now? So a general lifestyle advice is healthy diet, exercise, weight loss if possible, if applicable, quit smoking if applicable. Okay. Now screening options. There is no effective screening for ovarian cancer in general population, but in your case we can offer you CA125 and a transvaginal ultrasonography to see till you till we offer you definitive treatment, that is RRBSO. So in It's having a limited value, but we will be offering
It's
you.
ridiculous.
Yeah,
Yes, ma'am. Yeah.
limited limit. But in general population, we are not offering her. Screening for breast cancer will be offered in the form of mammogram and NHS breast screening program registration. They BRCA1 people, BRCA2 people will be registered earlier in NHS breast screening program. Okay, otherwise they're having their age limits when they will be entered. I don't know exact age limit, but I just wanted to mention that. The next line of if and the definitive management here will be a risk reducing surgery, that is removal of both the tubes and both the ovaries. Can be done through a keyhole surgery. It's having a risk of surgery, anesthesia, done by trained personnel. uh, Okay, this will cause menopause. Rightly offered her hormone replacement therapy to tackle this surgical menopause. This will eliminate the risk of cancer ovary completely, also minimizes the risk of CA breast, but there is a risk of having a hidden cancer at the time of undergoing this surgery. And nextly, uh, even if it eliminates the risk of breast and ovarian cancer, there is a risk chances of having a lining of the peritoneum, that is lining of the abdomen or tummy cancers in few cases. Okay, so this is the implication associated with this RRBSO. Timing of surgery. In her case, the surgery generally offers by after the age of 35 if she has completed her family. So, what are your thoughts on that? No, I wanted to have one more baby. Okay. Investigation CA125 pelvic USG till she decides to undergo RRBSO. Now, what are the options regarding her fertility? Okay, so I had mentioned here. So the fertility options are, then there is this chemo prevention also, which you can say she can be on oral contraceptive pills till she decides to undergo
Mm,
surgery. Okay.
mm,
Uh,
mm.
Now my last question. Okay, so what are regarding my future pregnancy? Since this is a genetic condition, there is a risk of 1 out of 2 babies will be carrying this gene and will have an increased risk of cancer in adulthood, not in childhood, in adulthood. So different people are having a different views regarding the future pregnancy. After knowing this, few choose to remain childless, some choose to go for adoption, but those who wanted to have their own biological children, uh, those who wanted to have their children, sometimes they go for egg or sperm donation to avoid this kind of faulty gene in their offspring. Alternatively, there are options which are available, that is prenatal testing and pre-implantation genetic testing. These both are invasive testing. PGT is after IVF. Okay. This will be done after IVF. If it is asked in elaborated way, then only you are going to say. Most probably she may be having these option concerns also. So that's the reason I am discussing this in elaborate way. That doesn't mean your patient will be having it. Your main answer has been already completed. If you have done very nice job and you are still having 1 or 2 minutes time, then she might ask. So that's the reason this is an additional information what we are sharing here. So pre-implantation genetic testing will be offered after IVF conception. If the embryos are positive, then those are discarded. Similarly, prenatal testing will be offered to the patients who had conceived naturally, but if the baby comes out positive for BRCA1, then termination is an option. To avoid this completely, to avoid this BRCA carrier status completely, few choose to remain child free or childless. Consider adoption and alternatives like egg or sperm donation to avoid this passage of faulty genes to the next generation. So these are the options. If she decides to go for egg freezing or egg embryo freezing, in that case, whether she is eligible or not, that we need to find out. That might be a question for from a patient. Okay, whether I will be eligible or not.
Ma'am,
Hmm.
Ma'am, if there is a girl child already for the patient, then is there any age limit that they have to go for a genetic counseling, or